Okay, so we're going to start muscle length, and in your lab handout you'll see on page 1 the first muscle listed is latissimus dorsi. So now what we're doing is having the patient relax, and we are doing passive range of motion using our goniometry that you know from patient care, and we're going to lengthen the muscle tendinous unit in order to see if it is of adequate length for that joint to have that full range of motion. So this is how we assess if the muscle and tendon is too short, not giving the range of motion that the patient needs. So we will discuss more of that in some lecture, but I want to get through the actual procedure so you can see what latissimus dorsi looks like and the length of it. We have Matthew here that is probably going to be a shortened length, so it's good to see what a joint looks like. So if I'm going to have him relax, I have to completely take control of the arm, and I have to bring him all the way into flexion. Remember, we're doing opposite its action passively. So if I bring him into full flexion, the compensation that I'm looking for is a lift of that lumbar spine area, and he has a nice compensation right about here. So you're letting the arm relax and you're letting gravity take over, but you're starting to look here at the lumbar lordosis. Hips and knees must be flexed so that it's flat to begin with. But right here you can see in the upper and the lower thorax, upper lumbar spine, he starts to lift right about here. So you want to take your measure before that compensation. So here it is again. You see when he's about at 90 where it is. Good, thank you, Shannon. And as he comes up, there's the lift right there. So we can see where the compensation starts. So right where the compensation starts, we're going to back that arm up and hold it and use our goniometry. So you want to feel what's going on with the joint, okay, before you just take the measure. And the measure, the landmarks that you're going to use is the same as your goniometric landmarks. So the axis is going to be right at that shoulder joint, at the acromion, of course, aligning the movable arm with the humerus to the epicondyle, and then of course the thorax is the stationary arm. So midline of the thorax. So right now I have 148. So I'm going to try to pull this off so the camera can see my 148 measure. So on that side, okay. So what's normal length? Thank you, Matthew. You can relax your arm. What's normal length is 180. So his arm should potentially be resting on the table, and the goniometer should be looking like this. So we know that Matthew's latissimus dorsi is short. We didn't quite get there. It's 148. Okay, so that's how you would document latissimus dorsi 148 degrees. Okay, so that's lats. All right, and that's how you take on muscle length. Oops. Okay, so the next one on your list is pectoralis major. We have two portions of it. The sternal portion, so the sternal fibers go diagonal and attach to the sternum, of course, and then the clavicular, the pec fibers will go right at the clavicular, the bone. So the clavicle is more of oblique, sternal more diagonal fibers. So to take those measures, position is still the same. I'm just going to get the chair out of the way. And in order for me to have him relaxed, now we're going to do horizontal abduction for your clavicular fibers. And if the patient's arm touches the table, that means he's of adequate length. So that would be normal. Okay. If the patient couldn't touch the table, let's say he was hovering up here, that would be a short pectoralis major clavicular portion. Okay. Same thing goes for, and then, oh, I'm sorry. Let me go on to say if he was short. So, and just hold your arm here for a second, because what I would do if he cannot reach the table is now grasp my goniometer, and we're going to use how many inches from the table, and usually you measure the epicondyle the humerus being the epicondyle most lateral part, or most distal part. And you're going to measure from that part to the table. So let's just make it a little more realistic. Okay, so right there. Okay. So if I were to take the measure, you could see he would be 3 inches, let me get it, from the tabletop. Okay. So he's resting on the tabletop. I know he's normal. So the other portion, your sternal portion, okay, is the one before it. Now, to measure the fibers that go diagonal, we're going to take the arm, or the extremity, to 135 degrees of abduction, okay? And if, again, if he's relaxed and his arm rests on the table, he's 0, he's normal. Again, if he was short, he'd be hovering, and I'd be looking for that epicondyle again, and I'd take my inches from the tabletop, okay, and just making it 3 inches again. So that's what it would look like. If the patient has extra tissue in the arm, just, make it so that it's flat. What you want to do is reach the bone. That's why we use the bony prominence. Don't use the tissue to measure from tabletop to arm. So you're using that bony prominence. All right, thank you. Obviously, if it extends off the table, just take where the humerus meets the table. Okay, so the next one is pectoralis minor, okay? So pectoralis minor is, okay, it says normal, 1.5 to 2 inches from the tabletop. So what does that mean? So I'm gonna just zoom in on his posterior acromion, okay? So I'm gonna palpate, here's his acromion, his posterior acromion is right here. Okay, so right where my fingertip is the posterior tip there of his acromion. And I'm going to measure how far away it is from the tabletop. So he's actually just above 2 inches. I would say 2¼ inches. So we know 1.5 to 2 inches would be normal. So if it were longer, and I'm just going to stretch out just a little bit, it would be pushing into that 1.5 to 2 range. But he's not. He definitely has a forward shoulder, so we're going to have more pull by the pec minor, bringing that shoulder forward, and we're going to be farther away from the table. Okay, so 2¼ 2.5, 3 inches away from the table means that he is short. Okay, so that's pec minor. All right, good. Let's see what the next one is. Did I get you? And have the arms in that anatomical position. And that's one thing that will make a difference. So let me just roll you out. Ooh, we're going to be a little bit, I'm going to take that again because I didn't realize you were not in the right position. Now, if I feel that acromion, see the difference it makes when you don't have them properly positioned. Here it is. Now he's 3¼ Okay, so now he's even more so. So if we don't have it resting, if we even have it elevated, it's going to give us different. He was kind of just relaxing here. So it definitely makes a difference with the shoulder. Okay. All right. Now we checked. Okay, so the next one is your rotators, subscapularis and infraspinatus teres. So I'm going to get a towel over here, excuse me, and support. And could you just move that way and here. Now I want that rotation to be level. So whether you put your towel here or you put your towel here, it doesn't matter. You just want it to be level and sitting in the, you see that, in the glenoid correctly. So for our external rotation, we know normal is 90. And just as you did in goniometry, you have the arm relax out. You're looking for compensations now. So any lifting in the area of the scapula, whether it's coming out lateral or the thorax is lifting off the table for external rotation. And of course you want to keep that humeral head in place. So he is relaxed and relaxing out. He's almost to 90, but not quite. There is a little bit of compensation. I can see it. If you can see it, I'm not sure. So right in here, you can see it pull, okay? So right before he compensates, which would be right there, I would take my measure, okay? Now, perpendicular to the floor, of course, and alongside of the ulna, in line with the ulnar styloid process, and we have 60, I'll let the camera see it, 69 degrees, right there, okay? So we know he is short, because it should be to 90, okay? Oppositely, doing infraspinatus teres minor, we're going into, so that was subscapularis, sorry, for external rotation. This way, now we're gonna watch that shoulder's starting to roll already. So make sure that scapula doesn't roll. We want the humerus to roll, but we don't want, there it is, right there, and it pops, right there. So I'm gonna take that measure before that pops. So there is where I'm gonna stop him. And again, same landmarks. And I didn't mention the axis, but you know it's at the olecranon. From goniometry, and I'm going to say he is 41 degrees, and we know it should be 70, so he is, again, tight for his infraspinatus teres minor. Awesome. All right, let's just go straight to our general elbow flexors. So general elbow flexors will be, of course, all of your flexors, so include the three, brachialis, brachioradialis, and your biceps. If he comes out, okay, does he reach 0? So that's your normal measure, and we're using our goni, and he looks to be 0, okay, and here he is, 0. Sometimes we have to put a little more overpressure, and gravity doesn't quite do it. With these muscle lengths, different from passive range of motion, you want to put a little overpressure so that you are really elongating the muscle, okay? So you want a little tension, not a stretch, but a little bit of tension there. So this is exactly 0. So if you can see the 0 point, that is perfect, okay? Your general elbow extensors is going to include the anconeus with the triceps, and we're going into elbow flexion, opposite its action again. So if I were to, and I see his tissue stops here, if I were going to just measure elbow flexion, I'm on the radial side with my movable arm, okay, my epicondyle and my acromion are my points. We have, and a little bit of overpressure, 140, let's see, you're doing okay, hon? You okay? Almost to 150, I think we can get to 150. Yep, we got to 150. Okay, so 150, sorry, I moved it a little bit. 150 would be normal for elbow flexion, okay? If he was short, it would be 130, 120, 110, 100. So think about previous to that. And every time we go towards extension, we know if the muscle is short, it's a negative number before we reach 0. So if we didn't get to 0, it would be -5 for elbow extension. He'd be here, -10, until we get to 0. If we go beyond, obviously we can go into the positive. Sometimes people are hypermobile at their joint, and they have a +2, +5. So that would be like a hyperextension in the elbow. So think about which way you're going. Are you going into flexion? Then it's going to be always a positive number. If you're going towards extension, it could be a negative number until you get to that 0 mark. And then beyond 0 is the positive number. Okay, I'm going to go to the next page. Next one is biceps. I'm hoping this isn't too long. So hon, come off the table towards me a little bit. Come with me. Okay, so 3 action of the biceps, we're going to go in the opposite of its action. Come a little bit more, just your shoulder joint. Leave your bottom this way on. Okay. Come a little bit more. Sorry. I know it's like on the edge. So the three actions of the shoulder joint, opposite their actions, I should say, is extension, shoulder extension, pronation, and then, oh my gosh, I said shoulder. Shoulder extension, pronation, and elbow extension. So those three actions need to be done to take a muscle length at the elbow. So, and he's fully relaxed. So what I have to do is I have to make sure that I stop my shoulder extension without his compensation. So right here, and if you need to block maybe with your knee. I usually have a stool here to help me support his arm with my leg. And then right at the end, I'm going to give a little bit of a push, a little tension to see, are the biceps fully elongated? And I'm going to use my goniometer. Obviously, we're going to 0. We have to stay in pronation. Okay. I'm going to 0, and he's right at 0. If he wasn't at 0, he would be here. Now, if the camera can zoom on in, that would be a negative 10 degrees of extension if I didn't get to 0. If I got to 0, I would go just as I did. Okay, that's 0. So that is a normal bicep length. Don't forget the three actions you have to elongate it with. Opposite its action, because it does shoulder flexion and it does supination with your elbow flexion. So you have to take it in all three opposite actions to achieve the length. Okay, the next triceps, we're going to wait till you get up. Oh, and then we just have wrist. Okay, so we're going to get you up off the plinth. You could stop there.